Helen Keller believed that the world's poorest and most vulnerable people deserve the best quality of life because they were not able to have anything but life. This is the main thing that started this charity in 1915. Being blind is something that sets people so far back in life. Regular day-to-day things that others can do, those infected cannot do by themselves, especially in an underdeveloped country that does not have the resources to serve the blind. So Helen Keller, along with George Kessler, came together to start this amazing charity. Their goal was to help the blind in these struggling nations and to give life back to those that need it the most. Since then, they have been able to reach out to over 22 countries and have established 120 different programs that help millions of people and children each year.
Helen Keller International helps those in need in 4 different ways. The first of which we'll be talking about is eye health. Eye health is something that they really aim to help for in the Asian Pacific nations. And what I mean by this is that they do surgeries and other things like that to help the health. Most of it is through cataract surgeries, though. And like I said, this is mostly done in Asian Pacific countries because that's where the most river blindness and cataract problems are. The second we'll talk about is nutrition and vitamin A supplementation. This is mostly in the African and Asian Pacific countries because those are the areas where they really struggle to get vitamin A. And vitamin A deficiency or night blindness is something that affects those areas. They do this by teaching the locals how to grow sweet potatoes and other products like that. The third we will be talking about is neglected tropical diseases. Most of these diseases originate from Africa, like trachoma and river blindness. Trachoma is a really disgusting one, though. It basically makes your eye feel like it constantly has sand in it, and this is really inconvenient and painful. And river blindness is just a bacterial disease that also hurts. The fourth is sight testing. This is one that's kind of unique and only happens in the United States. The sight test basically is they go to the most underdeveloped areas and test the kids for the sight, obviously. And if they fail it, they get glasses, and that is all provided by Helen Keller International. Most of the help that Helen Keller International gives is in Africa and the Pacific Asian countries, but some is in the United States, as we talked about before. In Africa, trachoma and river blindness is a real problem. It affects millions of people and can cause just complete havoc on people's eyesight. Eyesight is something that you don't get back either, mostly. If you lose it, it's gone. So helping people early with these diseases is really crucial. In the United States, the sight test really brings security to those people. They help the young children get the sight that they need before they have to worry about losing it or having it be affected by any other. Trachoma and river blindness, though, are the most important topics to talk about here. And since this is what A Path Appears talks about, we'll learn more about it.
There is a large need around the world to help those with preventative blindnesses. These come from three main causes. The first of which is called trachoma. It's a bacterial infection that causes roughening of the inner surface of the eyelid, and this leads to a breakdown of the cornea and eventually blindness. This disease affects 80 million people currently, and 230 million people are at risk. It also causes $8 billion of loss per year. The next cause is river blindness. This is caused from a parasitic worm that is carried by the black fly. 15.5 million people are currently infected with river blindness, and one strain causes epilepsy in children. Third cause of preventative blindness is the vitamin A deficiency. This is also known as night blindness. 250,000 to 500,000 people a year go blind from this. Half of these people, within a year of becoming blind, then die. Also, 1/3 of the world's population under the age of 5 is also infected with this disease. With so many people affected by these diseases or at risk of being affected by these diseases, these people need the help and support of us and the rest of the world.
Charity Navigator is a site that rates charities like Helen Keller International. Helen Keller International is known for having an excellent rating on Charity Navigator. On the graph that's shown here, you can see on the x-axis is the accountability and transparency score, and the y being the financial. Helen Keller International landed in that 4 region. It did this because on its transparency score, it received a 97 out of 100 and a financial score of 91 out of 100. The financial score is mostly based to the fact that Helen Keller International spends 84.4% of all the money it raises towards the cause. That means that 84.4 cents out of every dollar goes towards medicine, surgery, site tests, or teaching people about nutrition. Helen Keller International's excellent transparency score comes to the fact that they show everything. This means that every year they put out an annual record. This record shows all the donators that they've had that entire year, their names, the amount that they've donated, and all the employees at Helen Keller International by name. This is something that isn't unique to Helen Keller International, but is nice to see because that way you know that your money is actually going to what it's supposed to, and that everybody that works there is proud of it and knows that they are helping the cause. Now I will show a clip on how trachoma affects people and the kind of work that Helen Keller International does when it's on the
Trachoma is an infectious disease that affects the upper eyelid of a human being. It's caused by bacterium, and it affects most people in places where there is lack of proper hygiene and sanitation. If you're suffering from trachoma, when the eyelashes are blinking, they cause scaring to the cornea of the eye.
Usiku mchana hivyo hivyo haitoki usoni. Usema kwamba sijui mna vitu, lakini akitokee kitu.
The more you blink, the more the pain every second of your life until you get treated.
Nikiangalia nikuona kama ninatazama nitotoa sukulani.
Most people who are affected by this disease do not have the capacity to access the medical services that are available.
For those patients of trichosis, if they don't have any place to get service, they usually take a small knife to cut the eyelashes. That technique relieves pain temporarily, but the eyelashes coming after being cut, they are very sharp, so the lashes always rubbing the cornea, whereby one is getting blind from trachoma. One principle of saving the blind is you as care provider, you have to follow the blind patient to give the service. There were no surgeons in hard-to-reach areas, so we thought of training surgeons so that the patients can benefit the service.
During the selection of trainees, we made sure that trainees come from the grassroots level. Majority of them are clinical officers, so they meet the community each and every day. They are the community doctors, if you will, so they play a major role in addressing trachoma at the local level.
In our district, we sent 4 surgeons and they've already been trained. If the procedure was done very nicely, there is no chance of recurrence. If the surgery is successful, I feel nice because they'll say, oh, that's good surgeon.
School health program is a key program. HKI is trying to educate children, to give them knowledge on the disease so that they can take preventive measures so that they don't contract the disease. A simple kind of face washing can help them to prevent trachoma. Just a simple face washing.
Primary school kids can be very good ambassadors to the rest of the communities. They can bring the message home. Development can work better if it starts from within.
With international efforts put together, you can always dream of success in the future.
With the help of our class and possibly $75, we can help 300 children get the treatment for river blindness and trachoma that they need. With only $25, 20 families are given seeds and the help to harvest these crops. This charity operates with plenty of integrity, so you know any money that is donated will be put to a good cause. Helen Keller International's dollar goes farther than most other charities. This, along with our great reputation, are a few reasons why we believe you should donate to this charity and help countless children.